Hi, thanks for coming along my hip journey. I thought I would update you from the last time that I posted a video on where I am in the decision-making process for my leg. So when I posted the last video, I was discussing Dr. Rozbruch's impression on my candidacy for osseous integration, as well as what he thought my prognosis would be for my overall health and well-being, which was positive, in nature. So I thought I would, in this video, explain what osseous integration is, as well as what it is that I've learned so far about my particular aspect of my journey. So when I was coming back from New York City the last time on the train, I was jotting down some thoughts and formulating some questions, things that I didn't have the fortitude to ask while I was in New York, but questions that I certainly wanted answers to, and that I thought that he as in Dr. Rozbruch, would be able to answer those. So I crafted an email with some of those questions. Actually, I crafted 2 different emails because I wrote him, and literally within a few minutes he wrote me back, and so then I asked some more questions once I got answers to the first set of questions. And so I thought I would share some of the questions with you and some of the answers that he was able to provide, or direction he was able to give. So I have the list here. So the first thing was, what is the risk of infection for an amputation at this level? And he responded, minimal. And then I thought to myself, well, that's certainly something that I can research in medical journals. People who have had hip disarticulation, what is the infection rate? And so I'm in the process of gathering that information, and we'll include that in my next video. What is the risk of nerve damage that would impact bladder and bowel control? And he said he didn't feel like there was any risk of bladder and bowel control issues due to nerve damage. What about rejection of the stem? It's titanium, and there is no risk of infection, just like you would have screws and plates in a fractured limb, made of the same material, so no rejection. How about loosening of the stem that's inserted in the bone? And to be determined, there certainly is risk of it loosening if you twist and turn on the stem and do things that are contraindicated, meaning that you're not supposed to do. So there is risk of that, as well as risk of fracturing the bone the stem is in if you're doing things that are not recommended on this type of a procedure. And then any contraindications, meaning any other considerations or concerns that would prohibit someone from being a candidate, particularly me, and that's what I was asking for me, not necessarily a broad spectrum of contraindications, but for me, none. I also asked him about, in subsequent emails, who does he use to design and develop the prosthetic limb for his patients? Does he have more than one person? And would he encourage me to meet with them to further understand what my needs would be, and if I actually wanted to go in this direction, saying I would need a prosthetic limb? And he provided me with the name and contact information, and actually CC'd the prosthetist in his reply to me, and the prosthetist then sent me another message saying that he would meet with me whenever it suited, to get in contact with him when I wanted to come up to the city. So a lot of that has transpired in this time frame, and I've been to New York, and I've met with a prosthetist, and I will explain that in a separate video. But I thought it would be important to explain what osseous integration is in general, what that procedure is, and then what is it with regard to me. So that's what the rest of this video will be about. I did think it would be also very important for me to say just how incredibly blessed I am to have a physician that will continue to collaborate with you, or with a patient, with me. I just am thankful that I have a physician that will continue to talk to me via email. With regard to the procedure of osseous integration, depending upon the body part, you can certainly find those if you so choose to on YouTube. There are many that you can view and see, although they are graphic in nature, and that would be to your discretion. I'm not going to include them in my video journal, just because I feel like that would be something that you could look up and explore on your own. It's not something that I necessarily want to include in my video series. But please, if you are facing a decision on amputation, it's wise to know what it is that you would be facing on an individual basis, so that you're prepared for what that involves. So the procedure, depending upon what it is that you're doing, at what level, if you've already had an amputation and you're going to do the osseous integration, or you're doing amputation with osseous integration, your surgeon would dictate what that looks like for you. For me, it would be all in one, meaning that I would have the amputation and the osseous integration within the same procedure, within the same day. It would happen all at the same time. Your surgeon would determine what's best for you, depending upon your situation. So with that said, you can be an amputee and then go to osseous integration. It does not have to be a situation where you can't have that if you're already an amputee. So I just think, again, having been an athletic trainer and a medical professional, that osseous integration is just a remarkable option for people that are missing limbs, and the ability to have greater function with osseous integration is such a tremendous gift, and such a great opportunity for people who are unfortunate to not have their God-given limbs for whatever reason, whether traumatic or they're electing to take the limb. Which kind of brings me to another talking point, and I won't talk about it long because it's difficult. Since I've started this journey and watched other videos or researched people that are in my shoes, and people who had a traumatic situation where they weren't given an opportunity to choose whether or not to take their limb. I don't really think it matters which category you fit in. Traumatic and it was taken and you weren't able to make the decision, or a chronic condition yet traumatic that you're making the decision to take your limb. Previously in my journey, I was given an opportunity to pursue other procedures And I'll allow you to research what they are if you so choose. But one is a hip fusion, which means that you pick a position for your hip to be in, and it's fixed in that position. And another opportunity I had was a girdle stone procedure. And yeah, I think it's probably best that you just look it up, girdle stone. It's pretty traumatic. Equally, probably as traumatic as removing your leg. Those were procedures proposed to me 8, 9, 10 years ago. And, you know, I tried a few other things, and then I decided to do nothing for many years outside of just trying to maintain what I have through therapies, injections, medication. I chose no other procedures for quite some time. But I'm at a crossroads at this point of my health is declining, my orthopedic health is declining, and I need to try to figure out something. And so that's what's led me to thinking about osseous integration. Making the decision to amputate or not to amputate is not an easy one for anyone. The reason that I'm considering it, and I feel like I've covered before, but I thought maybe I'd touch on again, is reducing pain and increasing function, or maintaining function, because now I'm losing function. I'm going downhill very quickly. And how do I stop that? Well, what I'm doing isn't working. And there's this old saying, you keep doing the same thing, you're going to get the same result. So I don't think I have an option not to be looking at what the options are, as difficult as they may be to make. So the next video, I will discuss my appointment with the prosthetist and discuss the CT scan and that part of the decision-making process. So until the next video, I hope that you have a blessed day, and I hope that this video has been informative on what osseous integration is and how it may be applicable to your situation and how it's applicable to mine. Again, have a blessed day.